Hello all. Today we'll discuss about a topic called heat related illness, which is chapter number 455 in Harrison. So as the summer is approaching and as we can see it is going to be too much hot, few things has to be kept in mind when we are dealing patients in casualty. So we'll deal this topic in some headings, that is heat edema, prickly heat, heat syncope, heat cramps, heat exhaustion and heat stroke. So why this pattern is because all these events will occur in like a chain of events, one after other. So first about heat edema. So in initial few days of significant heat exposure, there will be minor edema of hands, feet, ankle, etc., which will be obviously as the body gets exposed to heat, there will be cutaneous vasodilation. There will be cutaneous vasodilation, which will lead to pooling of interstitial fluid. So pooling of interstitial fluid, which will result in edema. And one more reason for this edema is the heat itself will stimulate release of ADH, antidiuretic hormone, and aldosterone. So these two are the reason for minor edema. So the solution for this is it will resolve on its own. So no need to treat with diuretics. So no diuretics. Just advise the individual to rest with slight elevation of the lower limbs. That will resolve the edema. This is about heat edema. Coming to the second one, that is prickly heat, also called as miliaria rubra or lichen tropicus. These are few other terminologies for prickly heat. So here what happens is mainly clothed areas of the body, the sweat pore will be blocked. By skin layers such as stratum corneum. Then the sweat gland and the duct will be inflamed. That will undergo inflammation, which will lead to the destruction of duct and gland, and it will present as maculopapular itchy rash. So for this we can use antihistamines or chlorhexidine lotions, and we have to advise for breathable fabric clothing for the individuals. That will resolve the issue. This is about prickly heat. Coming to the third one, heat syncope. Here, especially the elderly, so when they are exposed to heat, already as we discussed, there will be cutaneous vasodilation and evaporation of the body fluid through sweat. Vasodilation will be there. And if they do some prolonged standing or exercise or sudden standing, such behavior or such activities will lead to further volume loss. So there will be volume depletion. This will lead to decreased venous return, which is the reason for having syncopal attacks. So elderly, if they are presenting with syncopal attacks, we have to consider this mechanism and try to replenish fluids. So this will solve the issue. And we have to advise them to be away from that heat source as much as possible. This is about heat syncope. Coming to the heat cramps. So here we have to consider individuals who are working in the fields, mainly farmers or roof workers or athletes who are exercising in heat weather. So in such individuals, along with volume loss, like fluid loss, there will be loss of electrolytes in the sweat. But if such individuals, instead of taking electrolyte rich fluid, if they take only fluids, that will lead to further dilution. So that will further lead to low sodium and low chloride levels, and they will develop muscle cramps. muscle cramps. So it is very important to advise such individuals to take electrolyte rich fluids when they are exerting in hot weather, not just the fluid intake. And here one more thing to remember is it will be considered as a mild form of illness because there will not be any rhabdomyolysis yet. Rhabdomyolysis will not be seen. So this is about heat cramps. Fifth one is about heat exhaustion. So here again, young or elderly individual or young who are exerting in the heat, young with exertion, or elders who are not acclimated to the hot environment, unacclimated individuals. If they do such physical exertion in hot weather, they will lose both volume as well as electrolytes. So they might be going through these phases already, but their core body temperature, if they keep on doing such activities in the heat, their body temperature will increase. Body temperature starts increasing. The nervous system, thermoregulatory system will come into action. So this will try to normalize the things. But in this case, the individual might develop headache, dizziness, or again muscle cramps, etc. So here important thing is to cool the body because the body temperature is slowly increasing. So cooling blankets or immersion in cold water will help. Cooling therapy and replenishment of the fluids and electrolytes through IV crystalloids can be considered, but it has to be done slowly. That is about heat exhaustion. Coming to heat stroke, it is considered as a condition with high mortality, especially in areas with too much hot weather. So here the same phase will be going on as in the heat exhaustion, that is loss of fluid, electrolytes, and the person is still exerting in hot weather. Then, as we discussed in heat exhaustion, thermoregulatory part of nervous system starts its action, and the core temperature will start increasing because of the cutaneous vasoconstriction in reflex. So there will be cutaneous vasoconstriction. So now it is preserving the heat, but at one point of time this thermoregulatory system will be dysfunctional. Now there is only cutaneous vasoconstriction left and heat is not dissipating out of the skin. So the core body temperature will abnormally increase to more than 40 degrees Celsius. This will lead to disastrous effect on all the systems of our body. So nervous system will be dysfunctional, CNS dysfunction, cardiomyopathy might occur, acute renal failure, rhabdomyolysis, coagulation defects, and liver dysfunction. All these things can be the manifestations in case of heat stroke, and it will lead to high mortality. So what we have to do is we have to focus mainly on the vital stabilization, as the individual will be having tachypnea, tachycardia, and hypotension. So this is first thing, and replenishment of fluid and electrolytes through IV crystalloids, but it has to be slow replenishment, and immediately to consider cooling therapies like immersion in the cool water, or we can use cooling blankets also. So these things have to be done in order in case of heat stroke. So these are some important illnesses which we might deal in coming 2 to 3 months of duration. Do read more about heat related illness. Thank you.